from Miss Howerton, K. You've got a long question here, but if I summarize it, it says, what is the difference between the anterior and posterior approach to the hip replacements? And then what are the pros and cons for each? I think the best way to answer this is really, if I can just maybe summarize my answer prior, because I really don't want to get lost too much in the details about the specifics between the different hip approaches. There's lots of them. There's the anterior approach, there's the posterior approach, direct superior approach, anterolateral approach, direct lateral approach. They go on forever. And they've all come in and out of favor at some point. But if I really try and summarize, you want a surgeon that has a relatively high volume, so anywhere between at least over 100 hip replacements or 100 knee replacements per year. Ideally, you'd have somebody that's done additional fellowship training in hip or knee replacements. The most important thing, however, I think, is that the relationship that you have with your surgeon is paramount. If you feel comfortable with your surgeon, then you need to be comfortable with them, that they're going to be able to manage you during surgery and manage any issues after surgery. If you go to somebody and you're very comfortable with them and they do the anterior approach, then I think it's a perfectly reasonable approach. It's a great approach for hip replacement. But if you go to somebody that does a posterior approach or a different approach, and you really like them and you think they're going to do a great job, I say go with them. Some specifics about the anterior approach. So some of the pros, there's a couple of papers in the literature that are well done that tell us that probably for the first 6 weeks after surgery, there is some benefit to going through the anterior interval for hip replacement. And some of the improvements or some of the benefits of that are maybe a reduction in pain postoperatively. So it tells us that if you have a posterior approach and your pain score after surgery is a 5 out of 10, maybe with the anterior approach you have a pain score of approximately 4 out of 10. So some people think that that's significant, and some people that's important to some people. And the other thing is, for the first 6 weeks after surgery, you may have closer to, not perfectly, but closer to a normal gait for that 6 weeks after surgery. After that 6 weeks, all the approaches are pretty similar. Some of the risks or cons about the anterior approach, it tends to be a longer procedure. You're on a special table. You're often using fluoroscopy or x-ray during the case, which prolongs the case. The placement of the incision is important. So the placement of the incision in the anterior approach is right in the groin, which is, the skin is not nearly as robust, and you can develop earlier complications after surgery with the incision. And then there's a potential for increased blood loss after the anterior approach relative to the posterior. There's some large blood vessels that we need to take care of when we do the anterior approach to surgery. And if they're not managed appropriately, you can have some significant blood loss after during that kind of surgery. With the posterior approach, really it's the tried and true method. It has been around as long as hip replacements have been around. And really we can manage any kind of defect, any kind of problem through the posterior approach. It's an approach that almost all hip surgeons are trained in and are very comfortable with. So there's an element of comfort as well with the posterior approach. Great visualization, even for surgeons who are doing very, very small incisions or minimally invasive surgery like I do. We still have excellent visualizations of all components during the hip replacement surgery. And then some of the negatives, really the biggest thing again is this, first few weeks after surgery, you may have a slightly higher pain level and a slightly abnormal gait. But again, by about 6 weeks, they all sort of rectify themselves regardless of the approach. And what I really tell patients is you need to think about it like a marathon. It's not hip replacement is not a sprint. Your outcomes 20 years from now are much more important than your than your comfort or your concern for that first 4 to 6 week interval after surgery. So great question. It's something that comes up all the time. I'm sure there's lots of people out there that have questions about that. So thank you very much.